The Ohio Children's Hospital Association commissioned a report by the Health Policy Institute of Ohio to honestly and transparently assess the health of Ohio's children. The report was released on September 27, 2018 at the Vote for Ohio Kids Leadership Forum.
Here's the bottom line. Despite the fact that Ohio has access to some of the most outstanding children's hospitals and network of pediatricians in the country, we ranked in the bottom half of states on 65% of national child health metrics. This disturbing metric is attributed to the fact that only 20% of a child's health is actually impacted by the clinical health care they receive, while the remaining 80% is impacted by non-health care factors. What we must remember is that if a child can't breathe because his parents couldn't afford an inhaler for both at home and at school, then he is not going to be able to learn. If a young woman is at school every day but is drowning in thoughts of depression and anxiety, then she's not going to be able to learn. If a child comes home and then goes back to school on Monday morning and their last meal was that previous Friday at school because there wasn't enough money to get through the month for food, then she's not going to be ready to learn. Good education starts with good health, and good health, as we are about to learn, is complex to achieve. Ohio needs a comprehensive approach to addressing child health, focusing on 3 child health policy outcomes identified by HPIO. These are mental health and addiction, chronic disease, and maternal and infant health.
Breathe in, Joey, breathe in. That's what Mommy says when she holds my inhaler up to my mouth. See, the doctor says I have this sickness that makes my lungs not work right. Something called asthma or matma or something like that. Anyways, it feels like there's a big rock sitting right on my chest, and I feel like I can't breathe. I have to use this thing called an inhaler when that happens. It tastes funny, but I always feel better when I use it. But Mommy says it costs us a lot of money, so we can only use it when I'm feeling really bad. I wish I could use it every time I don't feel good, but I know money's really important, and so I only try to ask for it when I really, really need it.
The recognition that as healthcare providers, we are just a piece, and often a small piece of the puzzle. The clinical care that we provide accounts for about 20% of those modifiable factors that impact health. And the rest of it are things sort of beyond the hospital's walls. It's things like the socioeconomic environment, the physical environment, the health behaviors of the household.
It tells you the difference that it makes to have a one-on-one relationship with a family in their home, in their community, and to be able to understand what they're dealing with on an everyday basis. And if we can provide that type of relationship, and we can start to address those issues around food, around transportation, around education, around employment, that makes a difference in that woman's life.
This pregnancy was different. I already had 2 boys at home, and so I thought I'd been through it all before. And I just knew it was different. I had headaches early on, and they just kept getting worse. My doctor told me to take Tylenol, that it was probably just stress. So that's what I did. And the swelling. My feet were swollen both times I was pregnant before, so I kind of expected that. But my face felt puffy, which had never happened before. I thought maybe it was just because I was having a girl, so that's why it was different. I didn't find out until later that my blood pressure at that prenatal appointment was actually 148/90, which should have been a red flag that I had preeclampsia, especially since I had headaches and swelling too. But it went unnoticed. I thought I was doing everything right by going to the doctor, but it got missed. My doctor told me to lay down, to calm down, and everything would be fine. My blood pressure went down before I left the office, so I figured everything was okay. A few days later, about 6 weeks before my due date, my back was killing me, and I was absolutely exhausted. I dropped my boys off at a friend's house, and drove myself to the hospital. When I got there, I started to bleed. I felt like my life was draining out of me. I remember the doctors and nurses saying something about my blood pressure being 160 over 100, and it caused an eruption. That's all I remember until I woke up with the nurse explaining to me that I was lucky to be alive. But my little Chloe was not so lucky. When they brought her to me, she looked like she was just asleep. But she wasn't. She never even saw a pediatrician. She never even had a chance to live. This kind of thing happened all the time in the 1800s. It's not supposed to happen in 2018.
It's as though young women of color are walking through a thicket of thorns, each sticking them throughout their life cycle, and it's unclear which one of those thorns, or the aggregate thorns, is leading to this type problem.
Invest in community development so that no one has to grow up in a thicket of thorns, so no children don't develop. And that's why the preschool education we heard about before lunch, and the effective child care, high-quality child care that was talked about, the early intervention services, so that we have healthy young women giving birth to healthy young babies. Because if you don't start the pregnancy healthy, you're not going to do well in the long run, no matter what kind of medical service you get.
I think that my ADHD and my depression and anxiety are all directly linked to my childhood. My dad died from cancer, and my mom coped by drinking and taking prescription medications. I was always afraid something was going to happen to her, and when it did, I moved to Ohio and my aunt and uncle adopted me. That was when I was 8 years old. I remember that I just wanted to be in the dark, alone, and I wanted to be unconscious. My sophomore year of high school was probably the low point. My aunt wasn't sure what to do because these thoughts just got worse and worse. They were trying to help me, and I wanted to get better. I was very close to being hospitalized because we all just felt helpless, like nothing we did made it better. Oh, maybe for a little while my mood would improve, but those thoughts and feelings kept creeping back. Those feelings, they're real. What people don't understand. Like a monster that just keeps trying to pull you back in. But when we found the music program, it just helped me so much. When I'm playing the violin, everything just kind of goes away. It's like an escape, and it helps me resist that monster. I know my anxiety and depression are things I will need to manage for the rest of my life. But I'm in college now, and I'm on a music scholarship. I know that I'm strong, and I have hope.
Of all the areas in pediatrics that have made progress over the past 25 years, this is the only one going in reverse. It is possible to change some of these numbers, but it takes significant effort on a condition that has stigma attached to it and people don't want to talk about. There are really bright spots out there. There are programs that we know work. There are states, entire states, that have decided suicide is no longer acceptable in young people.
As a part of how we think about our health, again, this is the collaboration piece. This is how we need to empower our communities to be more connected to children and young families who are weathering many storms.
We have to consider prevention all along the lifespan. These are life course conditions. So we know that almost all mental disorders have their onset before the age of 17. And so we can start early on in detecting these, and many have symptoms very early in childhood.
The message that we just want to reiterate that hopefully you've heard loud and clear is we want to get out of our comfort zone. We want to be partnering with all of you and others that are part of this amazing coalition who've organized ourselves around a singular purpose of advancing a pro-kids agenda, particularly with our next governor and our legislature, the Ohio Children's Hospital Association, Groundwork Ohio. We stand ready to work with all of you on this marriage between child health and early learning.
For copies of the report and more information, visit ohiochildrenshospitals.org.